Well, if I look back on my time earlier on in the Regional Health Authority, which covers basically the same geographical footprint as the North East and North Cumbria Integrated Care Board does, one of the things I look back on most fondly is the establishment of the second heart centre in Teesside. At the time, I was a young regional medical officer, and the Regional Health Authority was meeting and considering the way that services were organised. And I did a little statistical analysis, and that showed that the Regional Heart Centre in Newcastle, which at the time served all parts of that 3 million population, was not delivering the service equitably, in that people who lived in or around Newcastle were getting 3 times the access for heart surgery as people living in other parts of the region. So we looked at that analysis and had a long debate, and I recommended to the Regional Health Authority that the only way to tackle this was to establish a second heart centre. And we put that in the most deprived part of the region, the one with highest levels of preventable heart disease and early death from heart disease, and that was in the Tees Valley. It was an immediate success. One of the surgeons who was appointed to the new heart centre from London said that he was seeing disease in the patients he was operating on in Teesside in their 40s and 50s, which was at the level of severity that he would have seen only in a patient in their 70s and 80s in London. And that, to me, that little story, clinical anecdote, was more dramatic than any statistic. It told me that we were getting into the need, the deep-seated need that we had to deal with if we were going to be providing a fair service to all parts of the region. So finally, we talk a lot about reducing health inequalities, and usually it's a generational task. But this is an example where a fundamental health inequality of access to life-saving cardiac care was dealt with over a period of a couple of decades. And it's one of the few examples where you can address a health inequality quickly, effectively, and see the results flowing in almost immediately.